Hi, Dr. John Torres here on my Daily Doc, where I cover topics that you might have heard of, give you some information behind just the headlines. So it's not just a couple of sentences that might leave you a little bit confused, but it's information behind those headlines, and particularly information I hope you can use to help you, your family, your loved ones, and your community get through this pandemic sooner rather than later and as healthy as possible. Plus, we've added some other information as well, some other health news that might not be pandemic or coronavirus or COVID related, just because there is other information out there. And today, particularly, there's an important one. And then I answer questions you might have. So if you have questions, please send them our way. We try to get to as many of those as we can. But let me start with the headlines first. And so, first and foremost, you've probably heard about the boosters, the vaccine boosters, and what's going on with those. Well, to give you kind of a timeline, a couple weeks ago, the FDA authorized, emergency use authorized, a Pfizer booster shot for those who had gotten Pfizer vaccines for certain groups. And I'll go over that in a minute. Well, last week, the FDA went ahead and they gave authorization, emergency use authorization for Moderna and Johnson & Johnson ones as well. And then the CDC followed up with their recommendations. And so as of today, people who have gotten Pfizer, Moderna, or Johnson & Johnson that meet certain criteria are eligible to get booster shots. And there's a reason they want you to get those shots. We are now seeing the vaccines, for a lot of people, they're 8-10 months into getting fully vaccinated. What we have found out over time is those vaccines do a great job, and by great job I mean in the 80% range, 70% range for Johnson & Johnson, at preventing what we call the big three: preventing serious illness, hospitalizations, and death from COVID, which at the end of the day is what we want to do. But there are some experts as well that are saying, we want this to go a little bit further, and we want these vaccines to protect people from getting sick in the first place, even mild to moderate illness, and potentially spreading it to other people. And it was interesting watching the debate with the FDA and the VRBPAC, which is the advisory committee for the FDA, and listening to the experts talk, because they definitely fell into two groups. One group said, these vaccines are doing great. We don't really need boosters at this point. Let's get the rest of the world vaccinated to get the pandemic under control. And the reason we don't need boosters is because they're doing a great job at preventing that serious illness, hospitalizations, and deaths. The other side said, we want to make sure that we prevent even those mild to moderate diseases, those mild to moderate illnesses that might not put somebody in a hospital, that might not cause serious illness, but could still cause long-term consequences, particularly long-haul COVID, and it could potentially spread COVID to other people or coronavirus to other people. We want to get that under control, and we want these boosters to happen because we're finding out over time that the vaccines we got, some of us 8-10 months ago, are wearing off a little bit to a certain extent. And so over the past couple of weeks, they have authorized, given emergency use authorization for all the boosters, and here's where we stand right now. Now, for those, this is according to the CDC. So the way it works, and I'm sure most people know, it's a four-step process. There's VRBPAC, which is the advisory committee for the FDA. It's VRBPAC, the Vaccines and Related Biologic Products Advisory Committee, VRBPAC. It's a group of experts that get together, and that's step one. They debate what they want to do as far as the question that's being asked. And in this case, the question that was asked each time is, can we use these products, Pfizer, Moderna, and Johnson & Johnson, for booster vaccines? They said yes, emergency use authorization. We're recommending it for certain groups. And then it went on to the FDA commissioner. That's step two. The FDA commissioner then says, I follow up with those recommendations, and I like those recommendations. I'm going to go ahead and okay those. So once it gets emergency use authorized by the FDA commissioner, then it moves over to the CDC side. The CDC has two steps as well. Step number 3, which is the first step of the CDC, is the ACIP, Advisory Committee on Immunization Practices. And what they do is they sit down and they say, okay, here's what FDA authorized. Do we want to fine-tune those recommendations? They can't expand them beyond authorization, but they can fine-tune them down and maybe restrict them a little bit. In this case, they went along with those authorizations, but just gave us a little more detail. And then the CDC commissioner steps in and she says, this is Dr. Walensky, yes, I agree with that, or no, I don't. In these cases, she agreed with them for the most part. She only changed a little bit. But overall, the context was there, and she agreed with them. And then today, she came out with recommendations, which is the final step. And here's what she said. She said, for those who received a Moderna or Pfizer vaccine, these are the mRNA vaccines, there are groups of people who are now eligible for booster shots. These are eligible for booster shots 6 months after getting fully vaccinated with Pfizer or Moderna. And again, 6 months after getting fully vaccinated, meaning 6 months after your second shot of Pfizer or Moderna. And here's the groups they include: 65 or above, those who are 18 or older and they either live in long-term care facilities or they have health conditions, medical conditions that put them at a greater risk for COVID complications, or they work in high-risk settings or live in high-risk settings that put them up, that basically make them more likely to catch COVID. We're talking healthcare workers, possibly grocery workers, frontline EMS workers, those types, maybe police as well. That's for Pfizer and Moderna. But then the next step, she said, and remember, again, 65 or above, for anyone, those 18 and above, if they have those conditions, meaning they have underlying medical conditions that put them at a higher risk for COVID complications, or they live or work in high-risk settings, those are the ones that are eligible. But for Johnson & Johnson, what they said is, and again, that's 6 months afterwards, for Johnson & Johnson vaccines, they said for those who got one Johnson & Johnson vaccine, anyone 18 or older that were vaccinated 2 months ago, they're eligible for a booster shot. So again, Pfizer, Moderna, 6 months for those three groups. Johnson & Johnson, anyone 18 or above, 2 months later. And the main difference there is because the debate, when you watched it, was very interesting because a lot of experts thought that Johnson & Johnson, in the first place, should have been a 2-dose vaccine requirement. Instead, it was 1 dose. So now they're saying, okay, we're kind of playing catch up at that 2-month point. So anybody who's gotten it 2 months or more is eligible for a booster shot. Well, then they went on and they talked about what we call mixing and matching. And mixing and matching means just that. You can either match the vaccine you got before or you can mix it with a different vaccine. And they wanted to talk about whether they wanted to authorize that or not. And they ended up authorizing it in the long run. And that's exactly what they did. And the CDC recommended it as well. And so here is the recommendation. If you got Pfizer, Moderna, or Johnson & Johnson, and you're in those eligible criteria we talked about, any of those categories, then you're authorized to get any booster, Pfizer, Moderna, or Johnson & Johnson. So for example, if you got Pfizer, 6 months later, if you fall into one of those three categories, you can get Moderna or Johnson & Johnson. If you got Moderna, you can get Pfizer or Johnson & Johnson. And if you got Johnson & Johnson, it's a 2-month criteria. It's a 2-month waiting period to get a booster shot. And you can get either Pfizer or Moderna or Johnson & Johnson. And so again, this basically sets up saying you can get the same one you had or you can get one of the other ones. They did that for a couple reasons. One, they did it to try and avoid the confusion and try to avoid the hassle of having to go to a place and say, you know, oh my God, I got Pfizer last time, but you're only giving out Moderna or Johnson & Johnson. I need to find another place in which people would be more hesitant to get their vaccines. So they want to make it as easy as possible. On top of that, there is some information out there showing that in some cases it might be best to get a different type of vaccine. Number one, it's showing that if you switch out vaccines, there could be some potential benefit to it, but we don't know what that really means in the long run. And so what they are saying is, you know, the best advice is to get any vaccine. And if you get the same one you got before, great. If you mix it, that's going to work fantastic as well. The one thing they did talk about is Johnson & Johnson, people who ended up getting an mRNA for their second vaccine seemed to do better than people who got 2 Johnson & Johnson vaccines as far as their effectiveness at preventing COVID or preventing, again, that serious illness, hospitalizations, or deaths. But they also said, a couple of experts in the meeting said, well, here's some other exceptions we might want to look at and give people the options here. So if you're a woman, if you remember, Johnson & Johnson did have that very rare blood clotting issue in a few women, but if you're a woman and you have concerns about blood clotting or high risk of blood clotting, and you got Johnson & Johnson the first time, you might want to think about getting an mRNA, Pfizer, Moderna. By the same context, if you're a young man, and if you remember, the mRNA shots showed a very low risk of getting myocarditis. That's inflammation of the heart for these young men in particular. So if you're a young man who's at risk for myocarditis, then you might want to think about getting a Johnson & Johnson booster shot. But again, these are very rare illnesses. You're much more likely to suffer consequences from or complications from COVID itself. So just getting a booster, regardless of what kind, is the important one. But that's where they stand right now with those recommendations and authorizations they just went through. And that is as of yesterday, last night. And so today and from here on, those boosters are authorized for those groups I talked about at that endpoint, basically 6 months for mRNA, 2 months for Johnson & Johnson. So if you're in those criteria, get your booster. Now, the other vaccine talk is going on, some in the news, are the 5 to 11-year-olds, and where are we with them? Well, 5 to 11-year-olds, a couple things came out. Number one, Pfizer came out with information, and they looked at about 2,200 people, or 2,200 children, 5 to 11 years old, and they followed them for a few months, and they found out that at about the 2.5-month point, that the vaccine proved to be 90.7 effective, so almost 91% effective at preventing symptomatic COVID. In other words, preventing COVID with any types of symptoms. They also noted that side effects were minimal. Arm pain, low-grade fevers, feeling a little under the weather. They had no incidence of myocarditis, no incidence of blood clots, no incidence of Bell's palsy, no incidence of those things that were showing up in other studies, and once people started getting shots on a huge scale, did not see any of those. So moving forward with this information, what's going to happen? Well, again, it's that four-step process. Next week, VRBPAC meets to talk about 5 to 11-year-olds with this Pfizer vaccine. Then if they give an authorization, if they recommend an authorization, FDA commissioner will meet, will say sign off on it more than likely and say yes, I agree with that. Then it moves over to the ACIP, the Advisory Committee on Immunization Practices, the CDC's advisory committee, and they'll say, sure, I think we want to go ahead and do that, and here's how we want to do it. If you remember, the dosing for these 5 to 11-year-olds is a third of the dosing that it was for adults. As an adult, I got Pfizer, I got 30 micrograms in the dose. Children, these 5 to 11-year-olds, are going to get 10 micrograms. And that's what's showing in these studies. That's working very well for them. So if they sign off on that and recommend we want to go ahead and give them this 10 microgram, give it to them 3 weeks apart like I got my shot, then it'll go to the Dr. Walensky, the head of the FDA or the CDC, and she'll recommend it. And then once that happens, which is supposed to be the first week of November, if it all goes according to plans, then children 5 to 11 years old can start getting their vaccines. And so by all indications, at the end of the first week of November, 5 to 11-year-olds should be able to get their vaccines, which is great because this is a group that needs a lot of protection. And once we get those 5 to 11-year-olds, then we have essentially kindergarten through adults being able to be vaccinated, which will be great for getting back to school and keeping those cases under control in the school environment. And so that's where we are with that, with the vaccines. Now, the other thing I want to talk about are where we are with the numbers right now, and it's interesting because here in the U.S., the numbers are dropping. Right now, we are around, if I look at the numbers correctly, we are around 75,000 cases, and that's a big drop, and Dr. Walensky even said it was a huge drop from last week, and it seems to be dropping every week. Those are cases. Now, hospitalizations, as we know, lag behind that a little bit, and so it's going to be a little bit before hospitalizations start dropping that quickly. Of note, though, is what's happening around the world. Because if you look at other areas of the world, like the United Kingdom, for example, right now they are 46,000 cases. Might not seem like a lot, but you have to remember they're a fifth of our population. So that's essentially us being up in the 200+ thousand case range. And so, again, this is something that's very concerning, almost 250,000 cases equivalent to the U.S. I'm going to go ahead and put this in a perspective that, as you guys know, I like. It's basically the perspective of looking at it per 100 or per million cases. And in this case, what we have here is the United Kingdom. The United Kingdom is 758 cases per million people. The U.S. is 240. We were almost 400 at one just a few weeks ago. Now we're down to 240. The other countries that are of interest, for those who've been watching this, I just got back from Latvia, and Latvia itself has right around 1,500, 1,600 cases per million people. That's a huge amount of cases in their area. Spain, for instance, though, which has a high vaccination rate in the 80% fully vaccinated range, they are down to 40 per million people, which is a lot lower than we are, and hopefully we do get to that stage here eventually, sooner rather than later. But the point being here that we're about coming into the holidays, and so, getting vaccinated, getting your booster shots, and doing those things we know help, masking, social distancing, those can go a long ways toward keeping these under control. And by all indications, we're through that fourth wave. Hopefully we don't start a fifth wave. We think it's going to bump up a little bit, but hopefully not as much as in the past, mainly because of vaccinations, but the other things we're doing as well. And the last one I want to talk about is an important one if you are a user of aromatherapy, because the Consumer Product Safety Commission and the CDC just put out a warning about a product they are recalling, and it's a very important recall because the product is potentially contaminated with a dangerous bacteria. What they're talking about, and I want to make sure I get this correct, is the Better Homes and Gardens Essential Oil Infused Aromatherapy Room Spray with Gemstones. And again, it's the Better Homes and Gardens Essential Oil Infused Aromatherapy Room Spray with Gemstones. So what happened was, back in the early part of the year, there were 4 cases in the U.S., which is fairly rare because we usually only have a few cases in the U.S. per year because it is not endemic here in the United States. It mostly comes from Southeast Asia, is a bacteria with a very hard name to pronounce. It's Burkholderia pseudomallei. Burkholderia pseudomallei. And that bacteria causes something called melioidosis. Melioidosis is essentially an infection that is very hard to treat, has a very high mortality rate. Even with treatment, the mortality rate's around 20%. Without treatment, around 70%, particularly for people who are vulnerable. Diabetes, alcohol, people who have excessive alcohol intake, people with bad comorbidities, other types of medical conditions, especially immunosuppression, they have issues with this and have a high mortality rate, even with the antibiotics that can be used to treat this. It can also be difficult to diagnose because it's not something, again, there's only a few cases here per year in the US, so most doctors won't be on the lookout for it. Most labs won't be testing for it. And so doctors need to be very aware of this and keep an eye on it. But luckily, right now they're talking about 4,000 bottles that are out there that are recalling because these were sold through Walmart. And what they're saying is, if you did get this, what they want you to do is to go ahead and take these. They want you to double bag them in plastic bags, return them to Walmart, and then clean any area that you might have used these in. Again, they want you to take them back to Walmart, not dispose of them. The reason is because this bacteria, again, Burkholderia pseudomallei, can live in the soil. So if it gets into the soil, either near your house or out in the dump area, the trash area where the trash goes, then that can be a problem. It can live in there for years, and then it could infect somebody else. And so again, if you have any of these products, and I'll go over the name again, Better Homes and Gardens Essential Oil Infused Aromatherapy Room Spray with Gemstones, they want you to return it to Walmart, return it safely to Walmart, and essentially get it out of your house. So now let me see if you guys have any questions.
Should employees test both vaccinated and unvaccinated staff? We know that the vaccinated can spread COVID-19 as well.
So right now what they're saying is most of the employees have a couple requirements. One is to be vaccinated, and there's more and more mandates to be vaccinated across the country. And most of them say if you are fully vaccinated, we don't really worry much about testing unless you become symptomatic. If you're not vaccinated, then testing has to be kind of the norm for you on a regular basis. Now, the reason behind it, and yes, you are correct, people who are fully vaccinated can still catch and spread the disease, but it's much, much less likely that's about to happen. And so they're looking at resources and saying, let's go ahead and do two things. If we make sure everyone's vaccinated and everyone's tested, who's not vaccinated, then we're really going to cut down on the chances of people bringing COVID into or coronavirus into our building. And so they're looking at that saying, let's use the resources as best we can and test those who have not been fully vaccinated. And then hopefully they get vaccinated and they end up not having to be tested on a regular basis. But you are correct, they can theoretically spread it, and they not only theoretically, they do spread it, but in very rare cases, much more likely to be spread by those who are unvaccinated, and that's why they're asking them to be tested. But if you look at international travel, and I just got back from Latvia, when you travel, you often have to test, even if you're fully vaccinated before you go somewhere. And even before you come back to the U.S., you have to test 72 hours before you come back. So they're doing both. It's not on a regular, continual basis, but it is those one-time things. And you might find that certain offices say, let's do it regular testing for unvaccinated and occasional testing for fully vaccinated. That could be a possibility as well.
I'm 29 weeks pregnant. I still can't decide about getting the vaccine. What are your thoughts?
So the vaccine, and up until recently, the vaccine was one of those that a lot of organizations were saying, we can't recommend it, but we think you should be getting this. Well, recently, they've changed their tune and they say, we are recommending, and we're talking the American College of Obstetrics and Gynecologists, those are essentially the baby doctors, they are highly recommending that pregnant women get vaccinated for a very particular reason. It turns out that there's a lot of issues with pregnant women who catch COVID during the pregnancy. We're seeing higher rates of early term birth. We're seeing higher rates of mothers' issues, including some mortalities, unfortunately. Mothers have passed away. And we're seeing higher issues of stillborn children because of COVID being caught during pregnancy. And so getting these vaccinations, and they have proven to be safe for many, many pregnant women, is important to protect you and to protect the baby.
What do we do to prevent losing our vaccination card?
So that's a great question. So one of the things of interest is when I was in Latvia, it was very interesting because wherever you went, they scanned the QR code that people in Europe have. And it's a code they have on their phone, and they basically just present it because when you go into any restaurant, any coffee shop, any store indoors, you have to have this vaccination card or you have to have this vaccination code to show that you're fully vaccinated. So they would scan that. as somebody coming from the United States, and I was over there doing some work for NATO, so we had some other NATO personnel as well from other countries that were not in Europe, and they too did not have this QR code. They had cards, or they had a QR code from their own country that wasn't accepted over there, but most of them had cards like I did. So we would show our vaccination card, our CDC card. 80% of the places accepted that, but there were about 20% of the places said, we don't recognize that, we have to have something we can scan, you're not allowed to come in here. And so we'd have to turn around and go away. That's going to happen more and more often as more and more travel happens internationally, but it's probably going to happen more and more here in the US. So this, I think, is the time for the government to sit down and say, hey, we need one entity that can produce something like this, so we have an identification showing us that, yes, we got vaccinated. So if we go traveling places, if we go to indoor events here that might require it, we have a way to do that conveniently. Because if you do lose your card, it can be replaced. It's just a little bit of a pain to replace it. Essentially, you have to go back to where you got your vaccinations from and see if they can help you replace it, which is the best way to do it. So if you got it from a pharmacy, it's usually pretty easy. If you got it from a hospital system, it's usually fairly easy. If you got it from one of those mass vaccination centers, you're going to have to go to your state or your county or whoever gave that vaccination out and see if they can get you a vaccination card. But most of us hold on to that dearly, kind of like holding on to our passports. Mine's inside a plastic sleeve. And I show it to people and make sure I get it back right away, because that's all we have. Hopefully we get to the point where we have something that's on a national scale that we can use. And the reason it has to be on a national scale is because I actually did a story with IBM early in the pandemic just about this. And they said one of the biggest problems in the US is, since the US is not doing it nationally, there's 50 different states, and in some of those states, even some of the counties that need to do it, and that's too many entities for us to go to, because too many computer systems, too many different ways of them doing it to get it all collaborated into one fast and efficient system. It can be done, it's going to take a long time, way past the pandemic, to do that. And so if we had some repository at the national level that could both ensure that you got the vaccine and it's accurate and keep it safe and secure and private, that's what we need, which is essentially what Europe has. And so hopefully we can learn something from that. Hopefully, as more and more people start traveling, as the pandemic starts thinning down a little bit, we get something like that similar that we can use. But in the meanwhile, it's that card, so hold on to it the best you can. If you do lose it, talk to whoever gave you the shot, be it the pharmacy, the hospital system, state, or county, and see about replacing it. But again, thank you very much. This has all been fantastic, and I hope you have a great weekend. And like I always say, main point is that I hope you stay happy, I hope you stay healthy, and I hope you get through this pandemic as soon as possible. Thank you.